Hello friends, myself Dr. Veena's Academic here with my YouTube channel, that is Dr. Veena's Academic Realm. And today I am with you with one of the topic from nursing research, that is problem statement. And under problem statement we are going to study about the resources of problem statement. Last session we have seen about the problem statement definition, component of problem statement, criteria for problem statement, and what are the characteristics of the problem statement. But today is a part 2 where we are going to see about the what are the different sources for the problem statement, where which we are going to work out for identification of the sources of problem statement, where we can find out some of the problem statement for the research study. So let us start with the today's topic, problem statement part 2, sources of problem statement. So here if you see the problem statement as per the slide, there are different sources. Like first is the personal experiences, practical experiences, then critical appraisal of the literature, then exposure to the field of different situations, intuition, like there is something consultation with the experts, which we are going to find out the problem statement, then brainstorming, social issues, existing theories. These are the many aspects, or we can say sources of finding of the problem statement for the research study. So next, first we will see about the personal experiences. Personal experiences like my exposure to the particular field, clinical field, or if I am posted in the medical ward, surgical ward, ICU, OT, community area, psychiatric area, so that will be my personal clinical exposure, and as per that personal exposure I will have a personal experiences. So day to day personal experiences of the researcher may serve a good source of identification of and formulation of problem statement. So that is one source, that is personal experience, our personal experiences to the different clinical areas, which will help you to find out the problem statement. Second is like, for example, one of the example for the researcher, for example, if you are posted in the community area and you found that there are the percentage of accident in the home and its complication, and the child is suffering from that particular complication because of just home experience, home accidents. So home accidents, like we can identify that this is some of the issue in the home. So we can identify the area of our research study where there are so many experiences you take, and you can find out the problem statement. Then next is a practical experience. Second one, practical experiences. Like as I said, the practical experiences when there is a, you posted in the medicine ward, surgical ward, or like psychiatric ward, pediatric ward, in ICU, different areas you posted, and then you get the practical exposure. So with this experience we are able to identify different need of the patient, problem of the patient, and then we try to get the solution for that, and this is a second source of identifying the problem statement. So simple example, like for example, diabetes mellitus. You observe that diabetes patients in the medical ward, female medical and male medical ward, there are diabetic patient admitted in the hospital, and they are admitted with some of the complications. Once the patient is suffering from some complication, you identify this is the area where I can work out, I can find out the solution for this problem. Third one is a critical appraisal of the literature. Critical appraisal of the literature, that means like there are some books written, or there are some articles, published, unpublished material, where you find out the different areas where you can find out your, you can read and give your opinion for that, find out the report with the discussion notes, opinion, then articles, then you can find out the summaries for the clinical problem, some issues. So this is a area where you can find out the critical appraisal, or you think critically and find out the problem, and then find out the area where you can conduct the research study. Then previous experiences of the, like our previous experiences, like knowledge, if I have a knowledge with the particular topic, my previous experience, or my previous experience in the like some clinical area or some community area, psychiatric area, and then somebody has done the research also, that also gives the recommendation, previous experience or my previous study like BSc study or master's study, which will be helping me to find out the problem statement or area of study, research study for the PhD also. So previous experiences, Then existing theories, as we know, as a nursing student, we learn many nursing theories. The theorists have given the different theories, and then we apply that nursing theories to the nursing process also. And you can pick up only any area of that nursing theories which will be helpful for us to identify the problem statement. So existing theories. Next is the social issues. When we talk about the social issues like something which is existing in the society. Social issues, like there may be social issues, there may be some political issues, or there may be related to health. These issues will be relevant to the health. So for example, like if I give the example of HIV AIDS, like female suffering from HIV AIDS, so what will be the social issues related to that? I can conduct the study, like female feticide, sexual harassment, domestic violence. So to list out few, these are the social issues where we can identify what are the health related aspects and conduct the research study. Then next is a brainstorming, which is most important and very good source of problem statement. So brainstorming, that is stimulation to the brain or stimulation to the ideas or thinking. So like in our profession, nursing profession, there are few techniques, new questions. We need to identify the solution for that question, and then that will be a good research problem statement when it comes from the thinking, judgment, and some decision and identification of problem. For example, like there are few researches done which are like having some problems, and you find out this is something like new in this research. This is a recommendation given. Like for example, like nurses, PhD scholars or PG students, researcher, nursing faculties comes together, discuss and identify some major area of research study. Next is a critical appraisal of the literature. Critical appraisal of the literature, whatever literature is written, like traditionally or historically, there are so many literature available, and you find out, you want to find out whether it is authentic, whether there is some evidence. So again you conduct the study on the same matter, giving the or taking some ideas from that or formulating some problem statement from that traditional intuition or traditional literature which you have read out. Next is a exposure to the field situation. Exposure to the field situation, that means you get the experience to the different areas. As I said, a researcher get different experience in different areas, and then there are so many problems as per the area where you can find out the problem in different areas. For example, like you investigate, like immunization is given to the patient. So investigate what are the side effects, what are the immediate side effects, what are the late side effects related to health education. So exposure to the field situation also, it gives the idea to identify the problem statement. So these all are the sources of problem statement where we can identify different areas of research study which will be helpful to find out the problem statement and study accordingly as per the need of the society, at the need of the patient, and as a need of different specialization. So hope you understand this topic, and if there is any question, you can drop down the question in the comment box. Thank you once again.